The NEET PG exam is approaching quite fast, and I know most of you are stressed about your preparation, but those who are still stuck at some zone, how can they strategize? In cardiology, there is almost always one question from valvular heart disease, mainly related to diagnosis. अगर आपको लगता है कि हाँ इस टॉपिक में रीड करके समझ नहीं पा रहा हूँ या इस क्वेश्चन कैसे टैकल करते हैं समझ ही नहीं पा रहा हूँ, तो sit today, make a timetable for yourself, but keep the points that I told you in your mind. Hi guys, the NEET PG exam is approaching quite fast, and I know most of you are stressed about your preparation, rightfully so, because I've been there and most of the faculty have gone through it. So we all know how does it feel when the exam is fast approaching and there's a lot to cover up, right? Everything is piling up, backlogs are huge, and in such situations we may come to a point where I might have to settle with some compromise, either at the subject level or at the topic level, right? And one of the biggest question is the big four. When I say big four, I'm referring to medicine, surgery, and simple words finally subjects, obs gynae and peds. So these are definitely big subjects, and many of you might not have even reached covering these subjects, or you might have done partially. Well, best wishes to those who have already completed all the subjects are in the revision. This video is not for you, right? Shut down the YouTube, go back to your books and keep studying. But those who are still stuck at some zone, how can they strategize? Because you know, the result in exam is not always about how well prepared you are. It's about how smartly you strategized your preparation. Strategy does matter. So today we will take some perspectives how you can strategize your preparation around these subjects. The other subjects, according to the faculty's guidance or whatever is working for you, you can follow. Okay. So how to tackle the big four for the NEET PG? So let us understand two circumstances. So you're preparing for NEET PG, and currently you may be falling in any of these baskets. Okay. So the first basket is all 19 done and revising. I have nothing much to advise. Keep revising, keep solving the MCQs, keep taking the grant tests, and you will do well. Okay. Some subjects are all done, completed. You have done MCQs, you're confident, and you have some pending. And another circumstance is most of the subjects pending. Let us address a strategy for these two sets of students. So if some subjects are done and some are pending, decide what subjects are pending. And from the pending side, if minors are pending, or if your big four subjects are pending. So my suggestion is, if your minor subjects are pending, you can still complete them quickly, right? So I would still suggest you to go through the video lessons or the notes plus solve the PYQs. And for everyone, the base is always they have to give some grant test to understand the path. Okay, but if big four are pending, I can't recommend you to complete the main videos and then go through the notes and then solve the MCQs. You don't have that much of time. You don't have that luxury. So in that case, for such individuals, best thing would be for like go ahead with the rapid revision videos or the rapid revision notes plus PYQs and PYTs. Means what I would suggest is that complete one round of rapid revision videos, or if you learn good from the notes, just go through the rapid revision notes. You do not have to go through the videos. Once you've done the reading of rapid revision notes or listening to the videos, solve PYQs. And as you solve PYQs, you identify important topics. Like just to give you an example from medicine, in cardiology, there is almost always one question from valvular heart disease, mainly related to diagnosis or some murmur. One question on JVP or pulse. So you recognize these previous year topics, make a list, give another 1 or 2 days trying to complete the previous year topics. When you have completed the previous year topics completely, and you're confident that any question coming from the PYT I should be able to deal, then you can say, this one particular subject is closed. So do that for all the 4 big subjects. If you're standing here where you're completed minor subject, but you're pending with the big 4, that will give you a reasonable time to revise your minor subjects as well and have a decent grounding or footing on your big 4. But if most of the subjects are pending, what do I do? This is where many students decide, I will skip medicine. Medicine to hoga nahi. I will not be able to complete it. I will rather resort to other video modules. But my suggestion is, you do rapid revision for all pending systems. Rapid revision could be in the form of video or the notes, and here some of you might find it difficult to even complete the rapid revision videos on main subjects, right? Like the big 4 subjects. So in that case, from the rapid revision, I know it's a compromise strategy, but when we have less time, you don't have like beggars can't be choosers. So for the main subjects, I would recommend you to read all the previous year topics and do all PYQs. एंड अगर आपको लगता है कि हाँ इस टॉपिक में रीड करके समझ नहीं पा रहा हूँ या इस क्वेश्चन कैसे टैकल करते हैं समझ ही नहीं पा रहा हूँ, तो देन ओनली फॉर सेलेक्टेड सब्जेक्ट्स और सेलेक्टेड टॉपिक्स आई वुड से गो अहेड विथ रैपिड रिविजन. नाउ इफ यू आस्क मी सर ऐसे करके क्या मैं रैंक 100 के अंदर या 1000 के अंदर आ सकता हूँ? ऑफ कोर्स नो, यू आर still far away from that competitive edge, but you will better your performance and hopefully you will get a rank that gives you a seat of your choice, because something is of course better than nothing. So don't go to the examination hall skipping subjects, right? So rules are very important. There is a big no for skipping subjects. Medicine is most commonly skipped, mat karo, because the boards are not strictly adhering to the pro forma. Like the representation of subjects is not uniform. You may skip medicine and you should not be surprised if 50 questions come from medicine. In that case, you're literally finished. Even if you have done all other 18 subjects well, you still struggle to be in that competitive zone. So no matter where you stand today, do not skip any subject. So for every subject, have an individual strategy. Okay, biochemistry I have done well, already completed 2 rounds of reading, so I will revise it. Well, go ahead. I have done biochemistry partially and partially I have not done. So whatever you have already done, revise the same source. But what you have not done, like let us say 60% done, 40% not done. That 40% strategize. Like I have less time, I can't do the main videos or I can't do the main notes. Switch to rapid revision. Rapid revision also not possible. Aapko lagta hai I don't have that much time also. Then switch to the previous year topics. That's not possible. At least glance through previous year question. Don't do anything undone, right? No skipping is allowed. Don't skip subjects or important topics. You may choose to skip the low yield topics. Jahan se like in 3-4 years, maybe one question has come. But high yield topics, absolutely no luxury to skip. Just to give you some example. What are the main topics or high yield topics from medicine? Let us take the example of cardiology. So in cardiology, JVP, pulse, arrhythmias in ECG, then murmurs in valvular heart disease. If I talk about nephrology, the renal tubular acidosis and ABG. Yeah, glomerular disorders from pathology. If I talk about respiratory medicine, interpretation of PFT, these are like extremely high yield. If you do that, you're already mostly covering 50% plus questions from medicine also by just picking up the high yield topics. So please do not skip the high yield topics at all. The important topics and subjects, don't skip. So when you get into the examination hall, you should know that I've touched every subject. Either completely or selectively, but I've touched. I'm not going empty-handed on any subject. And then we should also have that reasonable belief that I've touched all important topics which are known. Renal tubular acidosis is a known important topic. You can't skip it. ABG is a known important topic. You can't skip it. So please don't skip any of those known important topics. By doing that, you will be able to surpass your own expectation, right? So I'm not giving you like a timetable, because timetable cannot be generalized. Where you stand is specific to you. If I give a times table and if I do it from my perspective, it need not fit your current situation or current requirement. So sit today, make a timetable for yourself, but keep the points that I told you in your mind, right? What are the points I told? If you have done all subjects, keep revising, keep giving GTs, right? And subject wise tests, and don't miss to include PYQs or PYTs in your last leg of revision. If you have done some subjects and some are pending, if minors are pending, I would still recommend you to go ahead with videos and notes and PYQs. Hopefully you should be able to gather sufficient time. If not, then you can switch to RR, but if possible, at least important topics do from the main sources. If the major subjects are pending, there's no way you will be able to finish them from the main sources. So switch to RR or the RR notes added with PYQs and PYTs. But if you still feel like, I feel as if I'm just starting now, the best suggestion is do RR of all the minor subjects, and for major, if you don't find sufficient time to do RR, be selective, but don't skip them completely. Selectively choose some PYTs and PYQs, and if you get some time or where you're not able to understand something, use RR videos. Okay, so that is the strategy that I would recommend what you should do for the big four, depending on where you stand today, right? So start preparing seriously now. The game is getting intense. Every other colleague is putting their best effort. So commit to yourself that you will put your best effort, and hopefully I will see you on the other end with a successful result. All the best, guys.